The hips are the primary weight-bearing joints of the lower quarter. As such, these are high-wear areas that need close monitoring as people age. There's a linear relationship with age and the prevalence of total hip arthroplasty procedures, with older adults comprising the majority of the population. Approaching rehab with older adults should always be done with sensitivity, but even more so with total hip replacements. Dr. Shawn, an outpatient physical therapist, understands that a variety of surgical approaches can alter which rehabilitation tactics are necessary.
So when we're looking at indications of what we might treat or types of exercises that we would choose, we have to consider the surgeon, the surgical procedure, the mode of the surgery. Did they come in from an anterior approach or a posterior lateral approach? And then of course the nature. Hip replacements and knee replacements both are constantly evolving in the technologies that they are using for implants. And so each of those variables will play a role in the post-op recovery and set those timelines.
After a total hip replacement, rehab is a mandatory step in regaining function and relieving pain. If this is the case, shouldn't the protocol at least be relevant and engaging? Dr. Berger thinks so. He bases his programs around functional movements that not only get results, but actually increase home exercise program compliance.
What we find when we study adherence rates and compliance for patients, that is to home exercise program compliance, we find that if we don't tie them to function, if they are just a linear A to B movement pattern, patients just won't do them. So the exercises I've chosen are all tied back at some level to some form of function, and if we explain that function to patients, and patients have that kind of light bulb moment to say, oh, I understand what the function is, then they are much more likely to participate in them.
The hips don't lie, and neither does Dr. Berger. Grab a Theraban CLX and stability trainer and learn the exercises he recommends post-total hip replacement.